Connecticut, Ms. Hayes.
Good morning, Secretary Becerra.
Good morning.
Thank you for being here. Before I get to my questions, there's something I just wanted to elevate for you. It's not often that I have the undivided attention of a secretary, so I want to share something that I read. The Trevor Project released the results of their national survey, and it said 52% of all transgender and non-binary young people seriously contemplated killing themselves in 2020. More than half thought it would be better to be dead than trying to live with the rejection, isolation, loneliness, bullying, and being targeted by politicians and activists pushing anti-trans legislation. You said many times today in this hearing that your job is to follow the law and enforce it. I appreciate your statement reaffirming your commitment to support for LGBTQI plus children and youth and their protection. So what I ask you is, in your authority as secretary, please protect these children. They are somebody's children. They are our children. That's not my question, but I just wanted to make sure I said that to you because as a high school teacher, I have had many kids come to my class before school, after school, to have conversations that they couldn't have with anyone else, who were scared and lonely and felt abandoned by the adults around them. And I just fear the direction that we're going, and just know that it is more important now than ever to do our job to protect these children. In my state of Connecticut, nearly 1,300 people died last year from overdose. That number is about 106,000 around the country. The opioid crisis remains a major problem in my district, particularly when it comes to access to care. On the same note, I saw so many families struggle with identifying that there was an issue with substance abuse, but desperate to find care or high quality care or something that they could afford. Many of these young people went on a 3-day hold in the emergency room and went right back home with no additional help or support. The fiscal year 2023 budget provides significant investments in mental health, behavioral health, and substance abuse services. Can you share how these investments will translate into access to care for my constituents, particularly young people?
Congresswoman, thank you. First, thank you for your comments earlier. Amen is all I can say to what you just said earlier in terms of protecting every American. In terms of what we're doing, we changed our strategy on drug use. Two of our elements that we included, that we all want to do prevention, keep people off drugs. We all want to do treatment to get them moving forward, but we've included two new elements to this as priorities. Harm reduction, because it's not just a matter of treating, it's keeping you from harming yourself long term. And the additional item we put into this new strategy is follow-up care. So we don't, as I said earlier, we don't want to just be like FedEx. We don't want to drop off the drugs to help you get better at the door and then, get out of town. We want to be there to follow you through, to make sure you, in that life course, we get you in the direction you want. And so we are going to use those resources to go there, and we're going to really focus on kids. We're going to make an emphasis on foster youth, because we know the troubles that they all face. So we're there, and we look forward to working with you.
I'm very happy to hear you say that, because as we all know, we are learning, addiction is a disease. And for years after the rehabilitative services, people are still struggling. So the harm reduction, the wraparound services, the long-term care is incredibly important. The budget provides an additional $30 million to support the development of opioid overdose reversal treatments and improve prevention services. What else can we do to provide community health providers with sufficient resources to prevent deadly overdoses and expand access to high-quality substance abuse disorder treatments?
I know you know this one. Provide support to the workforce. We don't pay them enough. They do yeoman's work. Many of them are former addicts. If we could let them know that we appreciate and elevate what they do, give them esteem, we could get more people working in this area. So if we could help the workforce, and they are committed, because many of them are former drug users, if we could let them know that we appreciate what they're doing to save a life, I guarantee you would find a lot of people would turn their life around.
You're absolutely right. I know that. I just wanted to hear you say it on the record. We actually just helped a constituent in my district with a very similar issue to connect with our workforce development programs and get training to go out into the community as a former abuser to now help out on the other side. Mr. Chair, I yield back. Thank you for being here today.
Thank you.
Thank you. The gentlelady from New York, Ms. Stefanik.
Thank you, Mr. Chairman. Mr. Secretary,